I know whenever we talk in person, we tend to talk for a good amount of time on medicine and just your expertise in the medical industry. But can you start off by giving some of your experience and credibility you have in the medical field?
Sure. I'm a family physician. I teach the Christus Spawn Family Medicine residency program here for 6 years now. Prior to that, for over 31 and a half years, I practiced in a town of 10,000 in western Iowa. Full spectrum family medicine, deliver babies, take care of those sick babies, those well babies, sports medicine, a lot of geriatrics. Iowa's an older state, and I have a certificate of adequate qualifications from the American Board of Family Medicine in geriatric medicine. I was a medical director for 3 different nursing homes in the area. On top of that, I was a medical director for a 19-county hospice, as I also have a certificate of added qualifications in hospice and palliative medicine. I moved down here so I teach full spectrum. I do a lot of office procedures. I'm in the Spawn South Hospital, supervising residents with their deliveries, and I'm in Shoreline Hospital about every 7 weeks, supervising our inpatient medicine team.
Yeah.
So it's what I love to do.
Quite extensive track record of knowledge. I want to start off by asking the coronavirus COVID-19, is it a flu? Is it like a flu virus? Tell us more about the difference between the actual flu and the coronavirus that we're dealing with today.
Lots of similarities, lots of differences. First of all, flu actually is in the broader family of coronaviruses, the influenza viruses. A lot of very big differences between the two, but the similarities are also obvious. Very infectious, both of them. People still die from the flu because we have so many people who don't get their flu shots. We see a large number of deaths, more than we have in highway deaths per year, by far. And yet we have a lot, obviously, people who survive. And I keep hearing a lot of famous doctors who aren't family doctors, who are other subspecialties, taking the national and on the radio, taking the calls and talking about things that they may know or have little experience with. Yeah. And so I get all upset about their lousy answers or their incomplete answers. So I'll bump on some of those while we're on today. But the flu viruses, my grandmother died 100 years ago, last 2 months, 100 years and 2 months ago. Got sick with the pandemic, the Spanish flu pandemic, on its 3rd resurgence, the 1920 resurgence. She got sick, and 2 days later, she died. She left a 1-year-old and a 2-year-old behind, as well as her husband. And that's how bad it was. The pandemic, the Spanish flu pandemic, had its first surge when it went into all the army camps, the Americans getting ready to go overseas. The second surge came out the month after, and throughout the winter after the end of the war. So in early 1919, we had the 2 different. Then the 3rd surge was in 1920, and that's the one that killed my grandmother.
So speaking about surges, now that we're on that topic, do you feel that it was a right move for the city to open everything back up, or do you feel it was too soon based off of maybe we don't have enough data and enough facts to know the extent of the virus?
People have to be proud, at least the ones who've actually taken this to heart, the business owners who've lost money, lost employees, that they did the right thing. I think the reopening, provided people follow all the recommendations, and it's obvious to me in the first weekend, people aren't following the people who weren't following the recommendations beforehand still aren't following the recommendations And that's not just here in Corpus Christi, it's all over. And then we're going to have another surge. We never had the surge down here because we did a lot of things right. But people are in such a rush now, and I can't blame them. No money for rent, no money for this, that it's stressful on families. It's a mental health issue. But on top of that, I'm very concerned that people are going to go out and try to do everything again. There were friends who picked up their food at a popular steakhouse either Friday or last night. And they had to go inside to pick it up. And there was no social distancing. None of the wait staff who had to go to the back to pick up the food were wearing masks or gloves. None of the other people working with and getting the bills paid were obviously cleaning their pens off. There were just a lot of things being done wrong. There wasn't an assignment of duties where somebody from the back brings it out here. Instead, the people from the front were running back and forth with the customers. Again, there's a lot of places that are doing it right, and there's going to be a lot who just don't. Their employees aren't going to do it right. I remember seeing one of the bosses of a chain on a national TV show, and they tried to do the curbside, and 3 days after they started, he stopped into one of his restaurants in Houston, and it was just apparent to him the people weren't going to do it right, and he says, just furloughed everybody. We can't until you're ready to do it right. We can't do it.
Yeah.
And
do you think that I guess that reaction of everybody just going back to normal, we're trying to go back to normal, not really paying attention to the guidelines, has something to do with the lack of information maybe provided?
No, it's stubbornness. Everybody's got the same information, access to information. Some people just don't believe that it's necessary. I have all these patients come into the office and we'll say it's time for the flu shot. Oh, I don't get that. Why don't you get that? I don't need it. Why don't you need it? Well, I've never gotten the flu before. Okay, so I've never had a car accident, but you should buckle your seatbelt. I've never had diphtheria, but that's because my parents gave me the DPT shots, the diphtheria and pertussis shots.
So let me explain to someone that the flu shot, right? They call it the flu shot, and it's seasonal. What exactly is in that flu shot?
Okay, the protein from the many proteins on the capsule to the virus. The virus is RNA or DNA, and they're different viruses. And then the things that make it recognizable, the things that also are the triggers for your body's immune system, are in the capsule. And these are isolated. Every year, about this time, they've been looking at what flu strains. There's two big families of flu, A and B. And we try to pick two different strains of A, and more recently we've added at least two most common strains of B. Now B tends to affect teenagers, young adults, more than the elderly. A is much more aggressive and worse to have, but people die from B yet. You can remember my brother is a pathologist up north. They had a patient in their hospital, was a 17-year-old senior in high school, got B, got a complication from that, and was dead in less than a week.
Yeah. So
17, healthy, track star. Well, I'm busy, I'm active, I don't get this. The number that die, probably 1 in 1,000, 1 in 2,000, 1 in 3,000, depending. But if you get the flu vaccine, right now in the Southern Hemisphere, in Australia, New Zealand, South Africa, probably Argentina and Chile, they are looking at what flu viruses, which tend to be wintertime viruses, unless you're on a cruise ship in Alaska in the summer, in which case all the people in the South come up and then we spread it. So, but if we're looking at the ones that are changing down there, and they will pick the most aggressive ones from there to put into the vaccine. And by June, they will have selected those. And by August, they'll be cranking out vaccine for flu based on what's going on now.
Is the vaccine actually like the flu? So are they like
No,
giving,
it is,
okay.
it is protein from the outside of the flu virus. Now that protein triggers your body's immune response. And it says,
Mm,
wait a minute, I need to make antibodies to this. This is a foreign protein, so that you make antibodies. That way, when you
mm.
encounter the flu,
You're
your body
prepared.
says, whoa, you're catching this? Let me, oh, look, pull open this drawer. I got something to fight this with.
Mm,
And you
yeah,
fight it. Now, people say, well, I still got the flu. Two
yeah.
problems with that. And it happened twice this year. Um, little old ladies, little old men, in the highest risk group. And I said, why won't you get the flu shot? Oh, 5 years ago, I got the shot and I've never been so sick. I was stuck in bed for a week and a half.
So,
It took, and wait, and I said, so how many days after the shot did you get sick? Oh, I don't know, the day or the day after. And I
yeah.
said, the flu shot takes 2 weeks to work.
So
I said,
why do you think that is? Like, I know that I've heard that as well. Like, where people say I got the flu shot, but it actually made me sick.
no,
What
okay,
is
so,
behind that?
okay, you have to turn on your immune system to make the antibodies to the flu.
Mm,
Part of that is about every third or fourth year, I'll get a low-grade fever. People will get a low-grade fever, little body aches, about 3 days after they get the shot. That's not the flu. That's your body turning on your immune system to make
mm,
antibodies to the flu. It's easily treated with Tylenol, Motrin,
yeah.
even aspirin, and it's not bad. And I remember getting that the first time I had the flu shot. It was in college, and I realized I was getting achy, low grade. And I went, oh yeah, I had the flu shot 2 days ago.
Yeah.
Boom, took some Tylenol, I
So,
was fine. But the problem is, it takes 2 weeks to work. So these people who said, well, I got so sick the day after the flu shot, it was the middle of flu season. They got the flu. They were sick in bed for 2 weeks.
mm,
Yeah, that's the flu. Now, the people, you're only 50% of the people who get the flu shot. Among this, it only drops your risk of getting the flu by half. But
mm,
everybody gets the flu shot. Nobody, whoever gets the flu shot, 0% end up in the hospital.
mm.
Zero
So,
percent, 0% missed more than 2 days at work. We've had
yeah,
nurses, young nurses in my practice before up north, who had the flu shot. We required it, or you couldn't work, and they tested positive. They got sick at work. They tested positive for flu. Sent them home.
yeah.
They didn't have to take Tylenol. You have to go 48 hours without a fever over 100.6,
So
without taking
let me ask you
Tylenol
this.
or
So,
Motrin in order to go back to work. And they were back to work in 3 days.
yeah, let me ask you this. So, the flu shot doesn't necessarily prevent you from getting the flu. It's just kind of taking a
It does.
precaution.
No, it does. It makes your odds of having the flu 50%
50%
less.
less. Okay.
But
Okay.
if you catch the flu, you don't get terribly sick. You get
Mm,
mildly sick for a
yeah.
day or two or three. Compared to, I had influenza A 1 year in residency. They put all these roadblocks in front of people back then trying to get the flu
Mm,
shot. Now you can get it in all over the pharmacies. But back then in 1980, I had all these rotations and I couldn't, they only said we couldn't get it in their own model clinic. I had to
yeah.
go to the hospital's employee clinic, which was only open for an hour and a half, 3 days a week, mostly to sign people back in after they'd been sick. Or we had to go there for the flu shot. I was on outside rotations during the daytime. I could not get a flu shot. I ended
Do
up
you,
Children's Hospital in
yeah.
December, and the residents who didn't have their flu shot made the weekly morbidity mortality publication from the Center for Disease Control. We were the first cases of Bangkok flu in the upper Midwest. I don't remember 3 of those days. I do
Let me
not
ask you this,
remember.
John. Let me ask you this. Uh, are we currently in flu season right now? Are we?
No, we're most people are going to tail end. By the
Okay.
time we get a surge in March, maybe occasionally in April. We're May. We're not
So
likely to see flu now.
January, March. Okay. So how many people died of the common flu this year? Do
I
we have a
can't
number
tell.
on?
We won't have the
Okay.
numbers till next year. I can tell you
Mm,
a year ago,
yeah.
you know how we have the big signs over the road that tell us 13,000 by December, 13,000 people have died on Texas. No,
Yeah.
3,800 people have died on Texas roadways from accidents. multiply that times 3, and that's how many people in Texas died from the flu last year.
Mm.
And no, it wasn't COVID-19, it was the flu.
Yeah. So
Okay, it was children, it was the elderly, it was people with underlying disorders. The flu, among all the common viruses, is the most inflammatory. It causes the highest fevers, it causes the most muscle aches, it causes blood vessels. And here's something that's not included in those flu deaths. We found out about 3 years ago that your risk, if you catch the flu without the vaccine, your risk of having a heart attack or a stroke in the 4 weeks after you get better. In other words, you're sick for a week and a half, 2 weeks. In the 4 weeks after you get better, you are 5 times likely, not 5%, not 50%, 500% more likely to have a stroke or a heart attack than you were if you hadn't had the flu. In other words, my risk here in 10 years for a heart attack or a stroke, because I'm at my age, with controlled high blood pressure and normal lipids and on a lipid drug, my risk of getting a heart attack or a stroke this year is about 0.8%. Okay? But multiply that times 5, and that's my risk of a heart attack or stroke this year in the 4 weeks after flu. So that, I mean, so again, now we take that, the small number of deaths, when you compare it with COVID, small number. Now, because of the treatments, because we were a month later with our first surge than, say, China or Italy or some of the other European countries.
But are those numbers accurate? The China and Italy, are those numbers accurate? Because we're getting...
No, they aren't. They aren't. Death was higher. But what we're learning now is the people who get it really bad, you know, almost all of them, not all, but almost all of them are high-risk patients. Medium.
Let me ask you this. I know that I'm very much into like health and you know, blood oxygen and keeping that circulation going. I have a question about the mask, right? So the mask prevents proper circulation.
No, you mean the N95 and the respirators, like the respirators that firemen wear into burning buildings.
Well, the N95, I can see those, but what about like if they put a cloth mask, like a bandana, that kind of, that kind of suppress the airflow and it kind of creates more?
No, no. You're not going to get, even people with bad lung disease aren't going to have a problem with a bandana or a normal surgical mask. They leak around the sides, airflow. What it does is if you cough or sneeze, it's going to slow down the particles. It's going to make them drop to the ground much closer to you than it would with a normal sneeze or a normal cough. It's going to reduce your transmission to other people. Now, why do we want people? Originally, we were saying it's not going to do you any good to wear one of those. And the reality is, if you're really around a COVID patient, it's probably not going to do anywhere near as much as the good N95s worn properly. But it can reduce other particles and stuff coming into your nose. So and we do want people who are going to go to the grocery store. Yes, wear a mask. If you can't, wear at least a bandana over your nose and mouth.
But the mask only, the mask, like if I'm sick, then I should be wearing a mask.
Yeah, no, even if you're going to go out and you're not sick and you're going to go in a store, you should be wearing a mask. That's what it takes to, you know, is it good? It's better than doing nothing. It's definitely better than doing nothing. You're going to decrease your risk of catching it from someone else. If you're already in the pre-symptomatic stage, you are going to reduce your risk of spreading it to other people. Is it the best? No, it's not like you're taking care of a patient in an ICU with all the personal gear. Well, but it is, and it's actually very rude for the younger, healthy people who think they're not sick and may be asymptomatic to be going around the grocery store, handling fruit, handling vegetables, putting it back down. without disinfecting their hands every time. Don't wear gloves in the grocery store. You're just going to spread things from one thing to another.
Yeah. So you know what? That's what I've noticed. Like a lot of restaurants and a lot of grocery stores, they're wearing gloves and they're handling the transaction, and they're packaging they're sacking the food, the vegetables. Is that how can that be transmitted as well?
You know, the nice thing about gloves on your hands, if you're handling food, if that's all you're going to handle, then take it off and start over again. That's
Yeah.
like we do in a doctor's office, like we do in a dentist's
Yeah,
office,
I know what you're saying. Yeah.
like we do if we're going in and examining patients in a hospital room. Those gloves are on, they're single use, they're off.
Yeah.
And then we still disinfect our hands before and
Yeah.
after, or we wash them with 20 seconds of soap and water. So, which does break apart the viral capsule, helps you wash it down the drain. So those things are good. If you're going to be carrying food to and from a table, and you can get the gloves, that would be nice to be able to do. But honestly, just disinfecting your hands before you pick up the plate.
Yeah.
Making, disinfect the hands totally, carry the plates out, put them there. Before you pick up more plates, before you go back. And the nice thing about the mask is it keeps you from rubbing your nose and touching your eyes.
Spreading it, okay.
Most cold viruses actually enter your body through your eyes.
Oh, really?
Back when I was probably around the time I was getting out of medical school, they did a big study, and every department in a university hospital has what they call weekly grand rounds. They present an interesting case, and then the experts talk about the disease, the process, the treatment, the downfalls, the pitfalls. And what they did is they videotaped the medical students, the resident physicians, and the attending physicians in that audience for this 45 to 50-minute lecture. At some point in that 45 minutes, 3/4 of the people in that room either touched their mouth or nose and later rubbed an eyelid.
That's
And that's doctors. We know better, but we're just so attuned to do. Everybody's so attuned. I tell you, like everybody else, my nose has never itched so much this allergy season is when I've been wearing a mask at the office for the last 8 hours.
Yeah.
But again, and you don't want to touch the outside of the mask because that's where everybody else's germs are.
So let me ask you this. I know that a lot of people, I've even seen this when I'm driving. People actually been hanging like the mask on their rear view mirror. They kind of like reuse them. Like they keep.
Yeah, that's fine. Don't touch the outside of the mask. Put it face down on a paper towel or up where you can get to it. Don't fold it so the strings are on the inside. If you put paper sack, you put it in the paper sack so it always faces the side that has the writing on it.
Yeah.
And then you can use that, leave it in the paper sack for 4 days, and the 4th day you can use it again if you're going to go out into a place. But put the mask on by picking the strings that touch the outside.
Yeah.
And then you put it on, and then disinfect your hands.
Are those masks made out of like charcoal?
No, no. Those are just normal surgical masks that you wear if you're going in the operating room, so your germs don't land in the wound.
Yeah. So those are one-time use masks.
They can be used 4 times, 4 days, 5 days, 4 days or 5 days, if you leave them in a paper sack or out in the air to disinfect for 3 days between. So we all have our little paper sacks with day 1, day 2, day 3, day 4.
Let me ask you this, John. So let's say I have a regular mask. It's not an N95. It's just a regular surgical mask.
Yeah.
How should I handle that mask like throughout the day?
Leave it on when you're in places like social, places where like stores. You go into the hardware store, you go into the grocery store, you go into the bank, whatever. Try to do as much as you can through the drive-through. Yeah. So you're not having to do that. And then disinfect your hands regularly, wash your hands regularly. If you touch your face, disinfect your hands. Get spray one or whatever and disinfect them. Carry it with you all the time. then if you're not going to use it, the shorter term, again, we're talking about masks that we have to wear for an entire day shift at the hospital. If you're only going to wear it for the 30-minute, 25 minutes you're in the store, put it on a napkin face down, and you can probably wear it again tonight or tomorrow, for a couple of days.
Yeah.
It's not totally disinfected, but it's clean.
Can you get sick? Can you get sick from a contaminated mask?
Sure. If you're going to touch the outside of the contaminated mask and then touch your eyes, sure.
Yeah.
That's why I'm saying don't touch the outside of the mask once you put it on. Pinch the little metal piece at the top, and so it fits, so it keeps the flow from going up over onto your eyes. And then when you take it off, put it, hang it on the rear mirror is fine. It's getting some sunlight. My son, the whole family's 3 doctors, and my kids are 3 doctors and a dentist. And you ought to hear the great discussions, because 2 of them haven't been able to work until this weekend, the dentist and the ophthalmologist, because you couldn't do any surgeries. And, remember the guy who first wrote the first paper and sounded the alarm in China, that they then came in, stormed in with police troops, made him write a retraction, put him in jail for a little while, took him out, got the coronavirus at age 29 and died.
So let me ask you about that. Let me ask you about that. Did he die because of the coronavirus, or was he murdered?
No. He was super sick, ended up on ventilators and died. Now here's the deal. The ventilators, turns out, normally we see somebody who's breathing fast and they are having trouble breathing and they're breathing, 40, 50 times a minute, and their oxygen saturation starts to drop. Our first inclination is put a tube in them, put them on the ventilator. Because with all the other diseases that will do that, other types of pneumonias and heart failure.
What does the ventilator do?
The ventilator breathes. It takes fresh air, puts it in, and then fresh air comes out by way of a filter. Okay. Puts fresh air. Turns out with corona, it's different. And we're learning that. We've been learning that a lot in the last month now. There's people who are, their O2 saturation in a young, healthy person should be above 90%, should be 95, 98, unless they're a smoker. And, so their O2 oxygen, when you measure it through the skin, should be saturated at a high level. But if they're dropped down to 80%, 78%, and they're breathing 50 minutes, but they're comfortable and they're talking to you and they're giving the whole history between the rapid breathing, those people are going to do worse. Don't put them on the ventilator yet, because the ventilator is not going to do a good job of forcing the air through the inflamed tissues in the lungs. So all of our old treatment and rules for treating acute respiratory distress syndrome, we've had to change them with this. The people, and if they crump so bad that they're on the ventilator, and they can't breathe, and those are the people that are going to shut down their organ systems. Their kidneys are going to fail, their liver's going to fail, their brain's going to fail. And those are the people that, yes, they're the ones that end up very little chance of coming off the ventilator. And those are the ones you've got nothing else to do for them. So it's not the ventilator that's making them crump. It's just their disease process getting so much worse.
Who are the high risk? What does that person look like? The high risk person.
They look like everybody in your neighborhood who's over 60 or 65.
Over 60 or 65.
They are anybody with diabetes. And in Texas, South Texas, we have a huge number of people with diabetes.
Yeah.
The less controlled you are, the greater your risk. They're the people with asthma and other.
So let me ask you this.
They are anybody who smokes or vapes.
So let me ask you this, John. 60 to 65, is that the age based off of maybe having a weak immune system? Because I mean, someone can be 30 to 40 and have a weak immune system as well.
Yes, that's why I'm saying everybody who's diabetic at age 30 is at risk. People with asthma at age 30 are at risk. At 15, with asthma are at risk. Everybody with lupus, rheumatoid arthritis, the autoimmune disorders, they're all at very high risk. People with blood coagulation disorders are at like brain fart. But those people are at high risk. They're all at high risk. One of our best doctors who's online, it does the Z-Dog videos, which are the non-medical people. He's known for his Z-D-O-G-G. He's a great doctor from Las Vegas, hospitalist. And he's done a lot of very humorous parodies and skits over the years. But he's also excellent. And at this time in his life, he's doing a lot of really great videos and recordings and interviews. I'll tell you, don't listen to Dr. Oz. He doesn't know what he's talking. Dr. Oz was a heart surgeon who gave up heart surgery and became a shill for all sorts of treatments that are unfounded. Even the hydroxychloroquine and Sean Hannity. I'm sorry, Sean. The rheumatologist that told him that it's safe. It is safe for people with lupus and rheumatoid heart disease. It's not safe for people. Our studies are proving that it's not beneficial in people with the coronavirus that are actually ill from the coronavirus.
Do you feel that maybe that's why everybody kind of wanted to hurry up and rush out and go to restaurants and go to the beach and go to parties, is because maybe there might be a misconception that you can only get sick if you're 60 to 65. No. But they're not seeing the other.
You can look at the Caller Times. They'll list the ages of the people who got it. Okay. There's obesity. Obesity in and of itself is a huge risk. Don't totally understand it, except fat is a very inflammatory tissue. It's highly involved in many of your inflammatory reactions within your body. And I have an acquaintance of mine who was very active in the Michigan Academy of Family Physicians. I knew him back when I was president of the Iowa Academy. Went to a number of luncheons with him. Delightful, giving, caring physician. And he died 4 weeks ago.
Really?
Yep. And he's younger than I am.
Yeah.
But he was obese and he had hypertension, probably diabetes. Don't know that. I don't know about the diabetes, but people but he was definitely younger than I am. We have a doctor, a visiting nurse from Corpus Christi who's been out in Reno, Nevada 3 or 4 months, got sick out there, died out there. He counts for Nueces County. 29 years old, I think.
So let me ask you this. I know Friday was the first day of, they kind of announced to reopen the city, partial 20%. If there's going to be an effect to this, whether it be, an increased number of cases, when will that we see that data? When will we see that information?
Over the next 4 weeks. And that's and it's likely to be good only if people stay 6 feet apart. Wear the mask if they're going to be in and around closer, people. It's so funny. I've got friends that I have little exchanges with periodically on Facebook. I don't do much on Facebook, but among the medical community, the family doctors, I know a number of them. I've been able to keep up with them. And it's just amazing. 1 or 2 of them got started the other day. How somebody walks up behind him in the grocery store, and the mask is below the nose. She says, "Excuse me, you have to wear the mask over the nose." He says, "No, I don't." He says, "Yes, you do." And he finally pulled it up in front. But then another doctor friend of mine was waiting to go into a store, and outside the store, there was the store employee, and a guy was screaming at her about, I'm not going to wear a mask. This is a free country and I don't have to wear a mask. And the doctor stood up to him and said, "Sir, you're right. It is a free country. They are free to keep anybody without a mask on out of their store to protect their employees and the other customers. And you are free to not wear a mask and not shop here." The guy hopped off.
Yeah, explain what you meant by that. They wore it under their nose.
It doesn't work. You know,
Oh, okay.
it's like the in the airplane lecture they talk about the when you're flying an airplane, loss of sudden loss of cabin pressure, the overhead bins will open and the
Yeah.
mask will drop down. Start the flow of oxygen by pulling down the mask. Cover your nose and mouth with the mask and slide the elastic over the top. You can tighten by pulling on one or both sides. The bag beneath it may or may not inflate.
Yeah.
And that's and you know, a couple of years, 2 years ago, when that window blew out of the Southwest airline jet, and the woman from Houston was immediately killed when she was sucked halfway out of the airplane at that altitude. And the people are taking videos of the masks and stuff, and they're taking and all these people are wearing the mask over their mouth, not over the nose. So they're not getting the benefit of the mask with the oxygen.
Yeah.
You know, you don't have to breathe. When you breathe through your mouth, you're still breathing through your nose.
Yeah. Let me ask you this: what are some things that you might be doing to so would it be good to try to boost your immune system during this time, or what would you suggest?
Go to bed on time. Get your regular exercise, which means 30 minutes of walking 6 days a week, brisk pace, but not so fast that you're shorter winded. Okay.
Yeah.
Not so fast that you couldn't carry on a conversation. But if you're walking with somebody, keep that social distance, keep that 6-foot distance. Eat a balanced diet. Hey, now's a good time to start losing that weight. That's 15 pounds that we had put on before. Time to get them off. Eat balanced diets. Eat a little less. You take off that fat now. During 6 months from now, during whenever the next third or fourth resurgence is, you're going to be at lower risk.
Yeah. What are some vitamins you're taking? What are some good vitamins? I heard that zinc. Or
controlled studies, very hard to do it with zinc, because zinc has a taste of a penny. You know, that's what they cover your pennies in. And they finally got something that flavored like that, did a study, and people who took zinc after they started their cold had symptoms on average 1 day shorter than the people who didn't. 1 day.
Yeah.
1 day short. By the way, the average cold doesn't go away in a week. The average cold goes away in 6 to 8 weeks. Okay.
6 to 8 weeks.
You get a cold in there, it affects the little hair cells in your nose and throat that line your whole airways down to your lungs.
Yeah.
The ones that are killed by the virus shed and get replaced right away. The ones who are damaged live the rest of their life not working. And they live 120 days. So it takes 60 days before half the damaged cells are replaced. So people say, how long does the cold last? Oh, a week or two. No, the cold lasts 60 days or more.
So would you say that our body is constantly producing antibiotics?
Sure. Antibodies, not antibiotics.
Okay. And so, but let me ask you this. So now that everything's like sanitizer, spray, Lysol, Clorox, are we kind of weakening our immune system by doing that?
No, you're just taking care of things on your skin at the time. You got an amazing immune system, and it's going to be sticking around. I mean, that's why your tetanus shot lasts up to 10 years if you don't have any dirty wounds. That's why the chickenpox vaccine cuts your chance of having chickenpox to 1/10.
Yeah.
And at 5 times the dose, it cuts 10 times the dose. It cuts your risk of getting shingles in half, but it cuts the likelihood that you'll have pain from that shingles at 6 months down to 1/10 as often. So I mean, that's your immune system. It's always working. It's always there. You scrape the finger, it gets kind of red and irritated. You're washing it. Antibiotics topically rarely help, but your immune system's remodeling. It's attacking any bugs that get in there. It's remodeling, and you're helping with the healing part. Vitamins are parts of your foods, and even vitamin C in high doses. You know, they're talking about massive doses intravenously on the super sickest patients, and even now they don't know if it's making a difference.
Vitamin C, you said?
They're doing some studies with intravenous massive doses, but massive doses for head colds increases your risk of getting cold sores. Massive doses in people who smoke. They were doing a study in the VA nationwide to see because vitamin C is an antioxidant, And one of the dangers of smoking tobacco is the high temperature particles in the smoke are free radicals. They're weakly radioactive. And so an antioxidant, something that could oxidize that and turn it back into a non-radioactive particle. Vitamin C is one of many antioxidants. So they gave, 500 milligrams of vitamin C to all these smokers at the VA. Half the patients got vitamin C, the other half got a placebo. It was supposed to be, wait, to see if they could prevent cancer. It was supposed to go 5 years. 3 years into it, they broke the code to see what was going on, and they had to stop the study. The smokers who were taking vitamin C actually were developing higher risk, higher cancer incidence. Okay?
Really?
And it was a huge study. So vitamins aren't out there looking for diseases to cure. Vitamin deficiencies in and of themselves can be a disease process. Think of inadequate vitamin C in Arctic explorers and sailors, and you get scurvy, where you get weak.
So would that be like how they say like you have to have a balanced pH level, a balance?
No, that's a bunch of garbage too. Alkaline water, your body makes everything at the right pH. You can't screw that up. If you throw alkaline water into your stomach instead of acid orange juice, almost nothing's going to happen, because your stomach already has to be acid and your small bowel has to be basic. It's far more than what you're going to do. Your pH in your blood is based on not only your kidneys and liver, most of your kidney, but also your lungs, the air exchange going through your lungs. We do arterial blood gases to see if you're metabolically falling behind because you're not bringing enough oxygen in, or if you're metabolically sick with bad lung disease and your carbon dioxide levels can't clear enough bicarb through your kidneys.
So what is the big difference? I know you brought up the alkaline water versus tap water, because I know tap water has the fluoride, it has the chlorine.
Well, you know what? In Corpus Christi, they didn't have the fluoride until 2 years ago. The rest of the world was fluoridating their water to prevent dental disease, and for some reason, they didn't want to spend the money to do it down here.
2 years ago.
Don't get me started. That's 2 years ago. They finally put the fluoride in our city water. That city water is buying bottled water somewhere else. You're just buying some other city's water. And they put it through a softener and take the fluoride out before they send it to you. So you don't get the benefit of the fluoride when you're drinking bottled water.
So let me ask you this. So because we didn't have the fluoride in the water system, was that like a health kind of issue? I mean,
a lot more dental disease, and people with bad dental disease develop more heart disease.
Oh, really? Because of the water?
Well, certain places have excess fluoride in the water, and you actually have to remove it. Fluoride, when we had the big 30 years ago, when they had the big farm crisis and they couldn't afford to farm as much, fields were put in set aside. They didn't have to produce. We get fluoride that we take for the cities is a byproduct of the production of those nitrous fertilizers. So we had a shortage of fluoride to put in the water. And yet, when I was in college, Des Moines was having this big problem with people not wanting to get the fluoride in the water. They thought it was bad for their health. Crazy. And they'd show up at the state capitol. State capitol's on the ground. They have an artesian well. So people were filling up their bottles. My college roommate was a biochemistry major working for the state at the time. He went down and measured the fluoride. Now that had excessive. That artesian well on the state capitol grounds had far more fluoride, 3 times the fluoride that they wanted to put in the water in Des Moines. A lot of people without knowledge.
Let me ask you this: how is the hospitals and maybe I'm pretty sure there's some offline forms of doctors kind of communicating. What are they predicting? Could happen, or what if you could share any of that, not to go much into privacy, but if you can just share kind of what because
it all depends. All the predictions are based on models. We totally beat the first models that predicted we'd be as bad as New York a month
Yeah.
afterwards, because we did a lot of the right things. But the models have nothing to do with reality other than the worst case and the best case. In the
Yeah.
best case, we'll reopen to 25% business. People wear masks, they'll use disinfectant, they'll stay home if they're sick. And even though you can't tell everybody who's sick because of there's going to be a certain percentage of the first 2 or 3 days have the virus, are spreading it without knowing it. But by the social distancing, we're not as likely to get it. Washing hands repeatedly, eating a balanced diet, staying healthy, getting some exercise, take your medicines, take your blood pressure pills, do all the stuff that you normally should be doing.
What is, like, how do we, is the only way to stop this is to kind of come up with a vaccine? Because that's not going to happen, right, anytime soon. So
it's going to be another year or more.
So do you think this is going to carry on for a year?
I think we're going to be fighting it to some degree.
For a year?
Over the next year, I think so. And then we don't know if the first 100 different vaccines that are being worked on, which ones are going to work. We have to go through stage 2 and stage 3 testing of these vaccines before we find out how effective they are. Clearly, having the antibodies does not make you totally disease-free.
Yeah.
We've had.
Let me ask you this, John.
Again.
Let's say we're 2 months into this thing, and they came up with a vaccine. Would you take that vaccine?
I would certainly look into it.
Well,
Got to realize I'm a science guy, and I'm not going to take it and go around and not wash my hands, not wear my personal equipment.
Yeah. So when you say you got to look into it, what is that actually?
Oh no, I'm the same stuff we do when new medicines are out. We look at the studies, we look at the papers, we look at the precautions, we look at the side effects. You got to realize when you're in a clinical study with a new medicine and you get a head cold, all the symptoms of a head cold get into that warning list in the physician's directory.
Yeah.
I mean, and then you have to compare that with the instance in the placebo, the people who didn't get the vaccine of the study. How many of them? You know what? Quite often it's the same time. It's the same.
Is that information like public, like the studies, or
yes?
Kind of...
The problem is people who've not had a science background don't know how to read it.
Yeah.
They don't know how to. I mean, they're the people that go on Google, Dr. Google, and they read everything that comes through. A lot of these articles that are coming out now have not been through scientific review.
Really?
What percentage? Publishing them.
What percentage would you say of that? What percentage would you say of articles that it's like miscommunicated and it's not accurate and it's kind of creating fear and it's giving?
Oh no! Well, there's one that came out the other day that is very interesting. That in Sichuan, China, 25 patients, 16 patients got the serum from people who'd survived.
Serum. So what is that? What is a serum?
That's where we take out people who've already had the body, have antibodies now because they were sick. They're out of the hospital. They're better. They no longer can see active virus, but they have antibodies. And we take the serum out like we did 100 years ago for certain yellow fever and certain things, and we transfuse the serum in. And not unlike what we do with rattlesnake bites. We have an antibody. We actually have it down to the size of the chemical that's the antivenom, and we infuse the antivenom. Okay? That's how different people need different amounts. Well, in this study in China, 16 people were so sick they didn't get it. 6 people were so sick they got it. 5 of the 6 people who got it still died. 15 of the 16 who didn't get it still died. There's no difference in the statistics. It's small. But the article hasn't been printed up for everybody to look at. We don't know how they selected who got it and how they selected who didn't. How sick were the people? And up in Houston, it's one of several sites where involved in a national study, and I think a few patients from around here have been logged into that study too. All these specific details have to be available to the people doing the study, and they'll find out over the next 4 to 6 months if the people who got it are surviving with fewer side effects, if they're surviving at a higher rate. It may be that they're surviving, but only to come back in the hospital later with a worsening again. All these things are unknown. So there's, we got to do the studies. That's what it comes down to.
Do you think that we're kind of in this situation based off the fact that we have no real studies, or we have no real information from China on any of this stuff, so we're trying to figure it out ourselves? Or
we're figuring it out with Europe. We're figuring it out with all the countries in Europe and South America. There's a lot better places to pool our studies. So hey, I love this conversation. You know how much you and I, when we get going, we take another turn, another turn, another turn. So the takeaways are social distance, wash your hands and disinfect, wear a mask if you're going to go in the store. Don't dilly-dally. Don't make 15 trips to the store. My wife keeps saying, put that on the list. You don't need to go to the hardware store today. And she's right. I've got my list. And and next fall, get your flu shots, because that'll help.
One more question. Do you have to take the shot? Like they say they come up with the antivirus, or what is it called?
A vaccine.
A vaccine. So let's say they come out with the vaccine in December. Do you have to take that, or that's something your choice?
No, but it'll be my choice. I mean,
but I'm saying that the general person, average person, do they have the right to refuse that?
Yeah, sure you do. Okay. You have the right to not wear your seatbelt, and you got your right to not wear your helmet. Okay. And you've got your right to drink poison. But, if you want to self-protect your loved ones, you're going to get the flu vaccine to prevent flu. You're going to get this vaccine to prevent this when we have one available. So, it's a free country. As my friend was saying, the guy was screaming, it's a free country. He says, and you're free to not wear a mask and go shop in somebody else's store.
Yeah.
So
true. All right, John. I appreciate your time.
Keep the faith and keep asking questions, keep reading, and
appreciate everything you're doing.
Stay healthy. And I'll see you at a Rotary meeting online.
All right. Later. Bye-bye.
Take care. Later. Bye-bye.